It's another day with the physicians where your health is our business.
Growth spurt will end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the Training Ultra on your regular program. Asthma is a major non-communicable long-term disease of the lungs affecting both children and adults. It causes the airways to get inflamed and narrow and makes it hard to breathe. Many different factors have been linked to an increased risk of developing asthma, although it is often difficult to find a single direct cause. People who have asthma may wheeze or complain of feeling tight in the chest. They may also cough a lot when their asthma is not under control. Asthma cannot be cured, but good management with inhaled medication can control the disease and enable people with asthma to enjoy a normal life. From our expert today on your regular program, The Physicians, we'll be talking more about this disease, asthma. Don't go away. It's another day with the physicians where your health is our business. Today we're talking about asthma, risk factors and possible causes, the diagnosis, the treatment and the management, and possible complications. My name is Dr. Martina Agberie. I'm not alone on this program. I also have my very beautiful co-host, Dr.
Memuna Yusuf Kadri, welcome on board. Of course, in the physicians, we know your health is our business.
We're talking about asthma. Do you want to tell me, have you had somebody who has experienced it before? Or a patient?
Definitely a family member, none that I know of, but a friend when we were younger. And anytime I talk about this story, it's always like re-traumatizing me because we're losing now. We could see
Going gradually?
Yes, going gradually. You know, now being a doctor, I know what they now call, what they call cyanosis, like turning blue. You know, she was just going and she was looking at us and like, I'm dying. Like she was literally telling us she was dying and we couldn't do anything because we told her, pack your inhaler, and when we were in between cities, it was a road trip. And at the end of the day, the only thing that saved us was the first house we got to. Somebody had an inhaler that he just bought when he was moving from one of the cities into that village, and that was what saved us.
Well, that's your own experience. I also have experience too, and I asked one of the girl, I said, how does it feel like? What does it feel like when you have crisis? She said, if I tell you the truth, I always ask, God, just give me this last breath. It's very traumatic. My daughter is asthmatic.
Oh, wow.
Yes, she is asthmatic, and immediately I knew she was asthmatic. I was like, no, not here, not again.
Not in this family.
Not in this family. Of course, you will try now, you forget medical person. No, it doesn't really follow.
In fact, I'm so happy with the experts we have on board today because they have gone extensively into this whole discussion on asthma and being researchers and, you know, clinicians. I'm sure our audience, going to have a lot of fun on set today with regards to this discussion.
Yes, well, my viewers out there, just hold on, don't go away. We'll be back after this short break. Welcome back. If you're just joining us, you're on to your regular program, The Physicians, where your health is our business. We have a guest in our studio. She is a consultant, respiratory physician, and lead investigator in the study achieving control of asthma in children and children air pollution profile in Africa. She is also the head of unit in the Lagos University Teaching Hospital, Lagos State University Teaching Hospital. And our is Professor Adeyeye OLUFUNKE. Then we also have with her Dr. AKPOJEME AFIEMO. She is a consultant pediatrician and in respiratory and allergy units in LASUTH, Lagos State University Teaching Hospital. We have very serious academicians here in our studio to give us the stuff that has to do with asthma, the control, the causes, the risk factors, and of course the management. Who else do you think we should run to? If not, Professor OLUFUNKE Adeyeye. And welcome to our program.
Thank you very much for inviting me.
You're welcome, Prof, and you're welcome, Dr. Afiemo. Lovely ladies with the lovely smiles.
Thank you.
Okay, so before we go straight to talking about the general overview of asthma, I'm sure you heard what when I was discussing with my co-host. And she did narrate an experience about a child, or rather a friend of hers, who had crisis on their way. So what do you have to say about that? What would have happened?
Thank you very much. That is actually a very familiar narrative. And the reason is the fact that people still don't understand the basis of asthma. And the fact that you don't wait for crisis, you prevent crisis. So now, what we know is that it's a condition where you have a chronic inflammation. So your treatment must target that inflammation to arrest. That your friend was not taking any maintenance medication. She was just wrongly placed on reliever medication. So the new guidelines for managing asthma now has moved over from that everybody that have asthma must be minimally on what we call inhaled corticosteroid. So that's the minimum thing that the patient must be. So you must be having an inhaled corticosteroid, okay? You know.
So do you want to just tell us an overview of asthma? Now let's know, what is asthma?
Well, asthma is a condition that is quite common. You know, most 339 million people worldwide is affected. And in Nigeria, you know, we'll say at least 10% of the population may have asthma. So we'll talk about asthma. It's this condition where you have chronic inflammation of the airway. So for no reason, the airway begins to behave as if something is irritating it, and therefore it swells, the lining swells. So when the lining swells, then the muscles also contract in addition. Then there's narrowing, significant narrowing of the lumen where air is supposed to go inside. And this occur usually is there on the, you know, all the time, but it can get worse, you know, on exposure to what we call triggers, okay, can get worse. And because, you know, and sometimes this condition continues, you know, and the patient complains of chest pain, tightness, difficulty with breathing, and they can have cough first at night, you know, and then the breathing can be noisy, what we call wheeze. So that's how the person presents. And for no reason, it can get better. So it can reverse spontaneously, or you need treatment. So that's it. So that's what we call asthma. So it's quite common, you know, but it's largely undiagnosed and largely, you know, untreated. Okay, that same study showed us.
Are there types?
Yes. No. So Dr. Afiemo, the thing now is that with what Prof has just mentioned of, it seems with years there will be increasing number of cases. What could be the reason for this? What are the causes? What are the things we should even look out for? Because people are now watching and like listening. 10 point something, now 13 point something. Then that means, who knows, maybe in the next 5 years it may be 15 or something. Let us all be educated on what could be the reason why people are having this.
Okay, thank you very much, and it's nice to be here today with the physicians. Now, talking about asthma, what could be the causes? There are several factors that have been attributed. Top of it will be genetics. There are some genes that have been identified, and so families who have a family member who has asthma, it's likely that in the younger generation, there might be somebody who will develop asthma as well, and those ones occur very early in the childhood. Okay, then aside from the genes, our environment, the environmental factors that also aid the expression of those genes, so that someone who is predisposed to developing the symptoms of asthma, who has increased hyper airway responsiveness, so any little trigger, the airway closes up and they are unable to breathe. So things like dust in the environment, and we know that now there's a lot of industrialization going on in the city of Lagos where we live. We know how much air pollution we're exposed to from our cars, from our generators, you know, and so those are some of the things that have been found to exacerbate the cause of asthma. Then there are also other factors as well. Some people are predisposed to developing the symptoms when they are exposed to certain conditions, weather conditions. Maybe it's really cold, then their airway responds to that cold, and then they develop the symptoms. It's interesting also to know that certain kinds of emotions, so if you're really stressed out, all right, people can actually come down with the symptoms. And then cold weather can exacerbate it. Some people, when they're exposed to different kinds of aeroallergens, they are called, things in the environment, so certain types of trees, certain types of grasses.
About burn oil?
Oh yes, oil. So we say those are biofuels.
Okay.
Fumes that are produced from those biofuels, oil, firewood in villages and homes, you know, those are some of the things that predispose someone in the environment who already has a genetic predisposition from developing this. So that's why education is actually very important to let people know that yes, the condition is there, but it can be controlled if we do our environmental control, manage and clean our homes from dust. Then we can be controlled.
Well, it looks like the risk factors, the causes are almost endless.
Exactly.
They're almost endless.
They're living with us.
They're actually living with us. Even the roaches, the window, the blinds and everything. Well, I'm sure when we come back, we'll go straight to the symptoms, because you have said so much about the risk factors. Why would the patient present? And you hold it right there. I need to go out and hear from what our people have to say. Those that have been those are asthmatic, the parents that have asthmatic children, even those that are exposed outside to the environmental pollution. Let us hear what they have to say out there on our for our friends keeping up with the physicians out there. Let's hear what they have to say. We'll be back after this short break.
Yes.
Yes. I'm even asthmatic, so I know.
Sure. It's a very common illness, a common disease now, asthma.
Can be smoke, some can be dust, some can be cold, some can be cockroach. So many things triggers it.
Sometimes caused by inheritance. Second one I know is about pollution of air.
Asthma can be caused by genetic problem. At the same time, it can be caused by excessive cold.
You start coughing, from there you'll not be able to breathe very well, so you have difficulty in breathing.
Speed breathing, and sometimes seems to be as if they want to seize the person's heart.
When asthma starts, it starts by attacking your lungs. You find you have breathing difficulties.
To me, I don't think so, but it can be managed.
It has a cure.
Asthma, English medicine, no. I have not seen any English medicine that can cure asthma, but I believe there are native medicine that can cure it.
You're welcome back. If you're just joining us, you are on to your regular program, The Physicians, where your health is our business. Today we'll be talking about asthma, the risk factors, the causes, and of course, the things that happens in the house that can make somebody know that these things are not easy, or they're not friendly at all, that you are not even aware of. That window blind, the netting, even the roaches. We've heard so much from the consultants here talking about the risk factors and the possible causes. Now we want to discuss the management, the complications, and what they are doing in terms of health education on this program. Professor Adeyeye is here. She's done a whole lot. She's a researcher, and I'm sure that is her field, so she's going to tell us more about it. So, Prof, let's talk about the symptoms, and you tell us how to manage it and what you are doing, because you are a researcher. What is the best mode of preventing it?
Thank you very much. When you talk about the symptoms, you know, one of the things is that person develop cough, okay? The symptoms of asthma they're usually variable, okay? So that it's like the symptoms are usually not there all the time. So the variability of the symptoms is one of the things we look at. Somebody complaining of cough, usually the cough is worse at night or early hours of the morning. Just keep coughing. This child keeps coughing in the night, okay? You know, children don't sometimes know how to complain. So it may just be that you notice this cough, okay? Adults who can present like that, because there's also an antecedent that cough variant asthma. Then, you know, if that is there, then somebody develop some chest tightness. They describe it more like chest tightness. That like somebody holding a band around my chest that I can't breathe down. So they can't breathe down. Yes. So that the breathing can't go down. That's usually the complaint. And then sometimes it's called the chest pain, but more of a tightness. Okay? So that when they then sometimes usually when they have exercise, you know, they notice this breathlessness, you know, maybe they had to run or do something in class, in schools, then the child has to come down, sit down and be resting, and they can be breathing with noise. You know, they have this, when they breathe and it makes a kind of a whistling noise. That's okay. So my chest is whistling, my chest makes noise. So you know, we all breathe. We do not hear us breathing. So these people, when they breathe out, they have some noisy breathing. You know, they make some musical notes when they breathe out. And when the obstruction is more, both in their breathing in and out, you hear it. Okay, so they may also have other symptoms that are linked to the problem, okay, that is not necessarily linked to asthma, but because of the risk they have of asthma, like itching their eyes, you know, the one that have atopy, what we call allergy, they can be having itchy eyes, brown eyes, all the time their nose is drilling, you know, dropping, you know, they keep dropping, you know, they have catarrh more than their friends usually have. And usually when they have these things, before they know what is happening, they can't breathe well, they start coughing, you know, worse at night, you know, they have this breathing. So it's that scenario, okay, that these symptoms come on, you know, and they can identify triggers most times. Like, oh, usually comes at night, when it's very cold, usually comes at maybe a season has changed, you know, there are whole lots of triggers that they know. Or somebody just accidentally prescribed a medication to this child for dysmenorrhea, for pain in school and all of that. So what do we do? One, awareness. We got to increase the awareness, got to increase conversation around asthma. Good. The Acacia study has showed us that, well, the schools are not prepared, okay, to handle children with asthma. So we're working, you know, with the schools eventually with the government to come out with our own position paper and recommendation of, you know, my school asthma program, you know, something to support the school. Yeah. So about what teachers need to know, what parents need to know, and what the student needs to know. We've done baseline research on that, and we know that the knowledge is totally, you know, unacceptably low, and you know, the outcome of that is not, you know, good for our students. So right now, while we, you know, also advocate that we've made a lot of leaflets available, okay, to inform people about asthma, available in our clinics, available in schools. We've engaged with parents. You know, we did that study in about 45 schools in Lagos, public schools, and then we have interaction with the parents. We've gone to so many open days, you know, meeting with parents. We've had engagement with teachers. You know, we had seminars, 2-day seminars for teachers from different education districts in Lagos, in our hospital, in LASUTH there, and we gave them a lot of information, you know, about asthma. But on the long term, you know, the long term thing is how to make our schools, you know, very, you know, asthma friendly, so that the information is available at our things, because the children can actually, you know, become unwell in school, and teachers are parents, you know, in absentia for those children, and they should be able to help. And one thing we notice is that parents themselves do not declare the health status of their children. We had a focus group with parents, and they told us we didn't tell them that their children have asthma. So when this problem comes, the teachers don't even know. So we need to demystify all the issues around asthma. The last World Asthma Day is trying to demystify, you know, the myths about asthma. People think asthma is contagious. It's not. So we need to tell them it's not contagious. Some of the asthma people will die quickly. They will not die quickly. We manage them well. Because, you know, but asthma can kill, but they will not die if they are well managed. They can fulfill their potentials in life. And then we also have a drama. You know, there's a drama intervention for that study that we showed in schools, and it's available online on YouTube now for people to look and we have developed how to use your inhaler devices, how to use all these things. So we have them online. So the theater is to let us know that people with asthma can be anything. They can be anybody they want to be, and being an asthmatic should not be a limitation to your dreams, not be a limitation to your ambition. It should not be a limitation to your aspirations in life. And the people with asthma can achieve the best in life, but they need the support of their peers, the support of their teachers, the support of their parents, and everybody around must know enough about asthma to keep them well.
Well, very good, Prof. It's all this, this is what people really need to know. Areas where we need to all strengthen, not only at home, in schools, so that it will be a win-win situation. When children leave home, they go to school. How do those places, how are they ready to make sure that these asthma cases are being properly managed? Dr. Afiemo, aside from what Prof has said, I know there are some other ways we could look at that people may not really be, bringing delight to right now. What are these other areas we can look at that we give this holistic approach so that nobody will be left behind with regards to managing cases of asthma?
Okay, thank you. Now, with regards to management of asthma, asthma is not a condition that you should hide or you should attempt to manage alone. You talked about your friend, if you were not there, she will not have been able to, get the kind of help that she needed. So asthma should not be hidden. It's not a curse. So people should be open about disclosing to schools, especially for young children who are unable to help themselves. The parents should disclose to the schools, okay? And then there are some other comorbidities that occur in patients who have asthma. So things like constantly person has a runny nose or itchy eyes or dry itchy skin. Those are comorbidities that makes asthma worse if they are not well managed. So seeing a physician who understands what this is and managing it properly will help. Coming to the environment, we have to do a lot of education. We need to use fuels that are friendly in the environment. So yes, it's very important. So we're not exposing everybody unduly to these harmful fuels. And of course in the homes, we should keep our homes clean from dust.
At least, if not anything, COVID taught us that.
Yes.
Wow.
Yes. So it's a whole lot. It's a joint management with all the various levels, the home, the school, and then in the community as well.
Well, if nothing else, at least the take home is we all have to be part of it.
Yes.
Public enlightenment is important. Advocacy in school is important. Parents need to be open to discussing it and letting the caregivers, even the school authority, know about their children. Asthma is not a death sentence. It can be managed. On this note, I want to say thank you so much, Professor Adeyeye, for coming on our program. And of course, to our beautiful Dr. AFIEMO AKPOJEME. Thank you so much for coming on our program. And to our viewers out there, I'm sure you have heard it all. Always keep a date with the physicians because we've promised to always bring the best. If you have never watched this program, you can always hear us, get to see us on our YouTube channel. I am Dr. Martina Agbere. Stay blessed.
Thank you very much to our lovely guests. You can see, not the beautiful ones are born right now. See our lovely guests all looking glamorous, beauty and brain all the time. And of course, this is what we promise you, and the physician will always bring you the very best. Don't forget to follow us on all our various social media platforms. And if you want to be a part of this program, you are just a click away. Till next time, my name remains Dr. Memuna Yusuf Kadri. Stay blessed.
I'm Dr. Yetunde Ayoyalo. I'm the founder of Market Doctors, and I also take care of the elderly at home. I want you to continue watching the physicians because they give solid advice and issues that are pertinent to health in Nigeria. Keep watching the physicians. Thank you.
So we have 5 kinds of viral hepatitis. Hepatitis A, B, C, D, and E. Of these 5 types, we're very concerned about hepatitis B and hepatitis C.